Dr. Ray Dawes is the co-chair of the Ontario Medical Association section on rural practice. He is in his 30th year of practice as a rural family doctor. He serves as the chief of staff at St. Francis Memorial Hospital, currently is the director of emergency services. He was the co-chair of the joint OMA Ministry of Health and Long-Term Care Physician Human Resources Human Resource Committee in the early 2000s. He was a member of the committee which developed the 1999 Rural and Northern Healthcare Framework, which is in your kits with a 40-year resolution about it. And he's a passionate advocate on behalf of rural doctors, and we thank him very much for traveling in today.
Well, thank you very much. Good morning, everybody. I'm very pleased to have been asked to be part of this most important endeavor to try and counter this government plan, this misguided government plan which you have had so well explained to you over the past few minutes. My focus is on rural practice and small hospitals, and I will stick to that in my presentation because these are the ones that I think are going to be hit the hardest. Now, it's customary for speakers to provide some sort of disclaimer of any potential bias in their talk, so I will do so. Mine is quite simple. If it wasn't for the presence of a small rural hospital and a very astute emergency doctor, I wouldn't be here talking to you. Because about 7 years ago, I came down with a rare form of flesh-eating disease, which was diagnosed in that little small rural emergency department that certain people want to close down. So I do have some bias. I was sent on to the big hospital after treatment was started, and I waited for quite some time before finally everything was sorted out. So I owe my life really to a small rural emergency hospital. I should say as well, I should say as well that I am chair of the section of rural practice of the Ontario Medical Association, but what I'm saying today is not OMA policy. These are my own personal views. I do know that the OMA is working on some sort of response to what's going on, as is the Society of Rural Physicians, the College of Family Physicians, the Canadian Association of Emergency Physicians. We're all working on this, and I'm part of that process, but the final policy statements are not yet available. This morning I'm going to try and provide an overall perspective of what I see as happening. I can't go into detail in 10 minutes, but maybe we can answer some questions later on. I'm going to begin with a quote. People in rural communities have poorer health status and greater needs for primary health care, yet they are not as well served and have more difficulty accessing health care services than people in urban centers. That's Roy Romano in his famous report. And another one. Every citizen in Canada should have equal access to health care regardless of where they live. And that's Justice Emmett Hall. So those are two pretty impressive people who seem to realize and understand the importance of health care in rural areas. And why are these principles suddenly being lost? I don't understand it. In 1999, I spoke at an OHA conference, and the title of my speech was the Y2007K Crisis. The Y2007 crisis. Now, you all remember Y2K. You know, that's when the computers were all going to suddenly freeze and the world was going to fall apart and the intensive care units would stop working and the financial system of the world would fall apart, which I guess maybe is happening now. But we also know what happened. Nothing. And that was because the computer planners and computer engineers were able to foresee a potential disaster, and they were able to deal with it. Well, my talk was about a crisis in 2007, and I predicted at that time a huge shortage of primary care physicians, long waiting lists, delays in diagnosis, delays in treatment. Well, I don't know if I got the year right, but we all know that this is what has happened. And one wonders why the healthcare planners back in the early 1900s didn't do a better job or weren't able to predict what was going to happen, and instead went the opposite way in cutting down on medical school enrollment and foreign graduates and so on. And it's interesting that much of the talk in their reports, the phraseology of it and the lingo, is very similar to what I read in the Niagara Health Report, which recommended the closure of the small hospitals in the Niagara area. So it's interesting, the computer planners did their job, but the healthcare planners didn't. I put it to you that we are witnessing today an incredible change in how medicine is provided in Ontario, and especially rural Ontario. And I predict that sometime in the next 10 years, we will be looking back on this, if this plan goes forward, we will be looking back on this with the same sort of disdain for the work of those planners as we now look upon of the planners back in the early 1990s. I'm going to comment on three aspects of the current problem. I'm going to talk about the effect on municipalities, the effect on the workers who work in those small hospitals, and most importantly, the effect on the patients. First, on communities. I'm not going to talk in detail. I think you have more sessions planned about that. But it struck me that last summer, there was a huge crisis in Montreal. And the federal government was ready to step in. Their provincial government was going to put all sorts of money into it. The municipality, City of Montreal, and local businesses were all in a state of disarray. And that was over the loss of a car race. Now, it seems to me that the loss of a small hospital in a small community is 10 times worse than the loss of a car race in Montreal. And yet, where is the federal government? I don't think the federal government knows what's going on here in Ontario. Our provincial government is behind it, and our municipalities and our local businesses don't have the ability to respond. So, again, what's going on? Why is this being allowed to happen? I'm going to talk about the effect on healthcare providers in rural areas. Most rural healthcare providers like myself thrive on that style of practice. We're not interested in urban practice, which is mainly office-based. We enjoy delivering babies. We like the hospital work. We like the diversity of that and the challenge of that type of medicine. So it follows that if the hospital goes, a lot of us are going to be thinking, you know, what's next for us? We've done all this extra training. We enjoy the work. Are we going to stay? I know in a lot of cases, doctors will not stay. There are some who say that the problem is that there aren't enough doctors and nurses willing to provide that sort of care. Well, I would simply say that sometimes it's necessary